One of the best things about Los Angeles, and sure, there's great tacos, and sure, there is great food, I guess, in general, and beautiful weather, an all-around nice place to live, but in addition to that, it is probably one of the most competitive, meaning the most amount of Medicare Advantage plans in California that are available that are directly designed for folks with both Medicare and Medi-Cal eligibility. And that means that they are all fighting to have the best benefit to outshine each other to get those folks enrolled, which is pretty good for those folks who have Medicare and also have Medi-Cal. So today, we're going to be talking about my 5 Medicare and Medi-Cal Advantage plans in Los Angeles in 2025. Hi, I'm Michael, and this is Michael's Medicare. Any of you or somebody you know is trying to figure out what is that best Medicare option for them this AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. First things first, let's talk about the very specific plans that are Medi, because they really have exploded over the last couple of years. And I think primarily because as the eligibility for Medi-Cal loosens up with things like removal of the asset limits, the raising of income limits, etc., it has meant that a lot more folks are able to start being enrolled in Medi-Cal and consequently get enrolled into Medicare on a long enough time frame. This means that the insurance companies who focus on this demographic can make plans that are designed with the intent of maximizing the available resources to those beneficiaries with their Medicare plans to try to get them additional benefits that can help with the many health complexities that come with being low income and retired in America. So let's look at some of the 5 Medi plans on my list in Los Angeles in 2025. First up is going to be my continual favorite, which is the Scan Strive plan. Now, the thing that makes this one interesting is twofold. First is the fact that it is a double special needs plan, meaning that it is designed for folks who have both Medi, so Medi-Cal and Medicare eligibility, but also for those folks who have a chronic health condition like heart disease or diabetes, which I mean, is everyone I know at least. Now this may not seem like an advantage, but it is, primarily because in 2025, unlike in previous years, beneficiaries on Medi-Cal will still have eligibility to change their plans every month under the Medi Special Enrollment Period, SEP, but they will only be able to move to integrated health plans. But having a chronic condition portion of this plan means that someone who has a chronic condition and also has Medi-Cal will be able to enroll in this plan all year round and not be limited by the integrated plan provision. Now, talking about benefits, because it is designed for folks who have Medi-Cal and Medicare, there's going to be a monthly premium and a very high maximum out-of-pocket on the plan. But if someone has full Medi-Cal, like no share of cost, those out-of-pocket maximums will be paid by Medi-Cal. So the beneficiary will keep that zero cost they are accustomed to. Furthermore, there is a comprehensive dental that allows up to $2,000 a year to use on things like deep cleanings, root canals, and those big dental procedures that may not be fully covered under Medi-Cal or Denti-Cal that comes with Medi-Cal. Also, from my experience, the customer's experience with Scan Health Plan is very different. And I would say better than many of the other plans that are out there. So first on this list, Scan Strive. It's new. It's a bit quirky of a plan, but I think it will be a really good one for a lot of our clients. Next up is going to be a true Medi only plan from Blue Shield in Los Angeles called the Blue Shield Total Duals plan. So as you would think, this plan, being a Medi plan, is going to have all the normal healthcare costs covered by Medi-Cal. So that is $0 for doctor's visits and $0 for specialists and deductibles and monthly premiums. But where this plan also shines is going to be in the extra benefits like a $1,500 hearing aid allowance per year, not multiple years like on some of the other plans. Additionally, there is a comprehensive dental coverage without an annual max or a deductible, a monthly groceries benefits that provides beneficiaries with a $50 a month allowance to buy health foods, which is definitely important. And besides keeping folks healthy, I mean, it's $50 less that someone would have to spend on food, so that's $50 more back in their pocket, really. So that is the Blue Shield Total Duals in Los Angeles in 2025. Again, probably gonna be a real popular plan. At the number 3 spot for Medi plans available in Los Angeles in 2025 is going to be a plan that is probably the most Medi of plans, which is another plan from Scan, but this one is the Scan Connections plans. And what makes this plan unique is that it really is the only truly integrated plan, meaning that when someone enrolls into it, they will have both their Medicare and their Medi-Cal coverage not managed by separate companies, but rather will be managed by SCAN, all brought into one single house. And that's a pretty nice benefit since everything is done in-house. There can be a lot less, miscommunications. That aside, it has some very strong benefits aside from the $0 cost, but includes things like unlimited transportation benefits, which I think is almost unheard of. Usually it'll have 40 hours per year of respite care, which means it gives a chance for the caretaker of the beneficiary to get a bit of time away from having those responsibilities to rest and rejuvenate. That one is obviously very interesting. A $65 a month grocery benefit. And in addition to the unlimited medical transportation, it will also allow for 24 non-medical transportations, which can be used for, maybe to pick up medications or go to the pharmacy or things like that. All in all, obviously the fully integrated aspect of this plan is one of the strongest benefits, but adding this on top of all the other benefits makes the Scan Connections plan a great option for many folks in Los Angeles in 2025. The next plan is one that I have not really had much of a chance to talk about, at least this year on the channel thus far, but it's a plan from another of the Blues. But this time it is the Anthem Blue Cross, and the plan is called the Anthem Full Duals Advantage Align Plan. And the thing that really makes this plan a good option in 2025 is, of course, that they will have a $0 premium for doctor's visits and $0 deductibles and $0 copays for all the healthcare services for those folks who have full eligibility for Medi-Cal. But in addition to these, the Anthem Full Duals plan has a very generous dental allowance that can be used above and beyond what Medi-Cal covers, but it will pay for $4,000 in annual dental services. Not unlimited, but still pretty good. Furthermore, as far as hearing aid benefits, the Anthem Full Duals plan has a set yearly allowance of $3,000 for both ears combined, which I would say is on the higher echelon of hearing aid allowances. And lastly, probably one of the highest trip counts available for transportation services, which is at 96 one-way trips from the year, while many other plans are hovering right around that 48 trips per year. So overall, the Anthem Full Duals plan makes the list because Anthem does have some very good doctors networks, especially in Los Angeles, that are going to be hard to find on some of the other plan benefits. The benefits are okay, they're all right, but their doctors networks are really a strong point for this plan. Last up today is going to be a plan that is going to be a company that is very well known in the Medi-Cal under 65 non-Medicare plans, which is from the company Molina. But this one is a Medi-Medi plan, the Complete Care Plus plan from Molina Medicare. Now, Molina has a long history in Los Angeles, as it actually was started in Long Beach in Los Angeles and has really grown over the last half century or so. Now, although until recently they hadn't really been involved in the Medi-Medi segment, now they are. That being said, the plan it's okay. It's okay. I guess there is a reason for it to be farther down this list, but it does have a $0 copay and coinsurance, has zeros in all the right places, whether it is for the doctors or the specialists or the deductibles and the copays. And for those folks who are eligible fully for Medi-Cal, and they have Medicare, then it'll pay for all those. It does have some extra benefits though, as far as extras. For example, it has a $100 debit card that beneficiaries can get monthly to buy over-the-counter items, and it has a $75 per month allowance that can be used to buy healthy food. So that is good, right? The dental allowance isn't really the most impressive at $1,000 for the year, but where it does make up some of the ground, at least to me, is going to be on its hearing benefits, because it will offer 2 hearing aids every 2 years, but with no copay, but also it's not a set allowance as well. So there's no messing with the hearing allowance and trying to price it out and figure out all that stuff. They will just have available hearing aids that can be picked out from their approved vendors. So sort of takes the whole stress out of trying to sort through the whole hearing aid thing, which, can be messy. So as you can see, there are a lot of great options in Los Angeles in 2025 for those folks who have eligibility for both Medicare and full Medi-Cal. That is no cost Medi-Cal, so not share of costs, but just full Medi-Cal. And when you start looking at the plans, it really does become less about the healthcare cost specifically, as these are all designed in a way that the costs are covered in full by Medi-Cal. But what does make a big difference on this, of course, is going to be the doctors' networks and the medications and the extra benefits that can save a beneficiary a lot of time and money and even effort to achieve their healthcare goals. And ultimately, that is a big value, I guess, literally and figuratively. It's just going to depend on which benefits a beneficiary would actually use and which could help them to achieve their healthier life. All right, so that's it for today's Michael's Medicare, and I really hope you enjoyed this video, and really, I hope you enjoyed all of our videos. And if you did, please don't forget to like and subscribe. And also, if you know somebody who is trying to figure out this or really any other Medicare mystery, please feel free to reach out to us at the information down below, and me and my team will be happy to help them in person at one of our many offices across Southern California, over the phone, in English or Espanol. So for Michael's Medicare, of course, I'm Michael, hoping that you have a great rest of your day, and goodbye.